Hey everyone, welcome back to Analyze with Casey, where we use data to pull back the curtain on healthcare. Today, I want to walk you through 5 real disturbing statistics that highlight something we don't talk about enough: bias and inequality in medicine. These are all pulled from reputable sources like the CDC, NIH, and peer-reviewed journals. None of them are theoretical. These are all happening right now in the real world. And if you're someone who believes that data should drive improvement, not just reporting, you're in the right place. Also, I'm doing something new. For every new subscriber, I'll be dropping one shocking or powerful healthcare statistic. So if you believe data should drive change, subscribe and watch the movement grow, one data point at a time. Let me also say this. I didn't come to data science just to make dashboards. I came because behind every real messy data set, there are real lives and real consequences. The truth buried in that data is what fuels my passion for healthcare. Let's get into the stats. Stat 1. Black women are 3 times more likely to die from pregnancy-related causes than white women. This isn't new. This disparity has existed for decades. It persists across income levels, across education levels, and even when access to the same hospital is accounted for. One name that stands out is Dr. Shalyn Irving. She was an epidemiologist with the CDC, a public health expert who knew the system, advocated for herself, and still died from postpartum complications. So what's going on here? Research points to systemic racism, implicit bias, and chronic stress from experiencing discrimination, something many Black women have spoken about for years. And if we're still losing public health leaders to these failures, what does that mean for everyone else? Stat 2. Non-white patients are 22% less likely to receive pain medication in emergency rooms compared to white patients. This isn't about preference or severity, it's about perception. Studies have shown that some providers still carry outdated and completely false beliefs about biological differences between races. In one study, medical students were more likely to rate Black patients as having higher pain tolerance. Let that sink in. This leads to actual harm. People in pain being ignored, families suffering longer. It's why so many BIPOC communities don't trust the healthcare system, and the data backs them up. This isn't just a healthcare issue, it's a human rights issue. Stat 3. A 2019 study found that a widely used medical algorithm prioritized white patients for care, even when Black patients were sicker. Yes, the algorithm was real, and it was being used in hospitals nationwide to identify which patients needed extra help managing chronic conditions. Why did it fail? Because it used healthcare spending as a proxy for need. And we already know that Black patients often spend less on care due to access barriers. So the algorithm learned white patient equals more money spent equals more care needed. That's not intelligence. That's amplified bias. This is exactly why diverse data sets, critical evaluation, and human oversight matter. We can't automate fairness without intention. Stat 4. 25% of transgender and gender nonconforming adults were intentionally misgendered or dead named by medical providers and staff. This is heartbreaking. Healthcare is supposed to be a safe space, but for trans patients, it often isn't. Whether it's misgendering or outright denial or refusal to provide even basic services, this discrimination can be fatal. And it's not just in small towns or rural clinics, it happens at major hospitals too. When fear of judgment or rejection keeps people away from care, we fail before treatment even begins. There's no ethical gray area here. Denying care because of identity is wrong, and the data shows how often it still happens. Stat 5. Only 6% of United States physicians are Black, though Black Americans make up 13% of the population. Representation doesn't just matter for optics, it directly affects outcomes. Studies show that Black patients are more likely to follow treatment plans, attend appointments, and report better experiences with Black physicians. It builds trust, it saves lives. But that kind of access isn't available to everyone, especially in rural or low-income areas, Finding a racially or culturally matched provider can feel impossible. This isn't a pipeline problem, it's a system design problem. And the fix? Intentional recruitment, support, and systemic accountability. These aren't just stats, these are warning signs. And they're not going away until we face them, talk about them, and act on them. Which of these stats is hardest for you? Have you ever experienced or witnessed bias in healthcare? Also, I'm sharing one new stat for every new subscriber I get. It's my way of growing a library of truth, one fact at a time. If you want to support this work and get weekly insights that matter, hit that subscriber button. One of my favorite quotes is seek first to understand, then be understood. That mindset is what drew me into data, because when we really listen to what the numbers are telling us and who they represent, we can finally start building systems that serve everyone. Thanks for watching Analyze with Casey. Let's keep asking better questions and demanding better answers.